The mental health system of Illinois is in crisis. We have state hospitals that are being closed. We have a critical shortage of healthcare providers around the state. We have children, adolescents, the elderly who are underserved, who are in need of treatment and are not getting any treatment, or getting some treatment but not enough treatment, are getting certain kinds of treatment and need additional kinds of treatment. Oftentimes, psychologists work in facilities where there are no prescribing providers who are specifically trained in mental illness or in the behavioral health disorders, and psychologists can't provide the further care that these patients might need. With prescriptive authority, we would be able to provide a comprehensive treatment to our patients. Our first line of treatment would always be psychotherapy. However, the research has shown that for some patients, severe kinds of patients who have severe levels of depression, patients who have severe levels of anxiety, certainly patients who suffer from psychosis, that those patients are treated most effectively with a combination of psychotherapy and medications, because there's a critical shortage of healthcare professionals trained in the comprehensive care of our citizens. There are citizens that are not being served because psychologists are not able to serve them in a comprehensive manner that includes the prescription of medications. Psychologists have been prescribing for 20 years. They've been prescribing in all branches of our military throughout the United States and throughout the world. Psychologists are prescribing. We have over 30 psychologists prescribing in New Mexico. We have over 75 psychologists prescribing in Louisiana. We have psychologists prescribing in Indian reservations. We have psychologists prescribing in the United States Public Health Service. We have psychologists prescribing in the Coast Guard, and it's part of the Department of Homeland Security. There have been no adverse events by psychologists who are prescribing over these 20 years. There's every reason to believe that psychologists will continue prescribing safely and will prescribe judiciously.